So good afternoon. I'm Chris Cooney with the Metro South Chamber of Commerce, and we're delighted to be here with another edition of our virtual interviews. And this is a great educational opportunity to meet a new chamber member and a new employer in the city of Brockton and in the Metro South region. And I'm delighted that we have Kathryne McNichols with us today, who's no stranger to Brockton.
I'm not.
So you were telling me that you worked in the city for a number of years.
I have. I worked over at Signature Healthcare for 12 plus years in their oncology department. And I joined Vitra Health about 6 months ago now. And I'm excited to be here. I'm excited to be back in the community as it continues to open.
That's great. Well, welcome back. And I understand that you're now with a new employer that's been growing in leaps and bounds, even since this pandemic started, going from what I understand in 40 employees to over 160 employees in that time frame. So can you tell us a little bit about Vitra and where you are in Brockton?
Absolutely. So Vitra Health was founded in 2012 by Max Voshin. He had a vision and he really took it to the stars. He wanted to see how we could help people in their own homes and, prevent them from being hospitalized, prevent them from going into nursing homes and assisted livings. In our local area, not just Brockton, but in our local area, we have a lot of families that are living together, multi-generational homes, that the children are caring for their parents, etc. Sorry, my texting alert went off. I'm sorry.
Yes, that's the virtual world that we're living in today. So.
Yes.
So Max and his wife developed this.
Yeah,
company.
they did, and we're really heavily Mass Health funded, and we contract with several other insurances. We have been, like you said, growing like a weed during the pandemic. More people are trying to stay home and in their own homes, and we're seeing more caregivers, more children and siblings, cousins, friends caring for their loved ones to keep them safe at home and not subjecting them to the virus.
Yeah, so you're doing direct care at many different levels in the home, and my understanding is a adult day health center that's newly opened with new facilities right here on North Pearl Street in Brockton. Can you tell us a little bit about that facility, how big it is?
Absolutely, sorry, absolutely. We have almost 10,000 square feet. It's an amazing building. It's completely renovated. We have 2 large activity rooms. We have 2 dining areas. We have pretty much a restaurant style kitchen. We also have exam rooms that will be manned by our nurses that will be here on staff every single day. If a client comes in and they need medication or they need their blood sugar checked or anything like that, they'll be on hand to do that. We offer multiple activities, exercise classes, card games, foosball, pool. We have the TV, we have reading areas, puzzles, magazines. And we also have gated outdoor space with flower beds and other gardening.
There is, yeah.
Thank you.
Yeah.
Gardening spots where they can tend to their gardens, and they're also gated and locked, so there's no chance of wandering. It keeps them safe and secure. The building is secure at all times. We have all handicap accessible bathrooms, and we actually have one handicap accessible shower, which is very rare at this point. We make sure that everybody is taken care of in the most safe and healthy way for them possible.
Okay.
We also provide transportation.
Okay, I was going to ask you about that. So it's adult daycare. So how many hours on average, do people spend there? How does that work?
It can be anywhere from 3, 4, 5 hours to 8 hours a day. It depends on the clients and their caregivers' needs. We offer transportation to and from the facility within a certain mile radius. I don't know that we've actually talked about what that mileage is at this point, only because of the pandemic.
Sure.
But we also offer, if a client is coming to us and needs to go to a medical appointment in Brockton or the local community, we will take that client to their appointment. Say they need to go to Brockton Neighborhood Health Center for blood work, or they need to go get a chest x-ray at Signature Healthcare, or see a doctor at Good Samaritan Medical Center. We can take them to do all of those without impacting their caregiver's workday. So it's sort of a respite for their caregiver to actually be able to have a day to themselves, or whether it's working or doing their own personal errands or their own personal health appointments.
So it sounds like you make pre-arrangements. You go and pick up the client at their home. You bring them to the facility, planning they're going to be there 4, 5, 6, 7 hours. It sounds like if there's a doctor's appointment on that particular day, you'll bring them then to the doctor's appointment with an
Absolutely.
assistant. Okay, with an assistant.
Absolutely.
Okay, and can they eat at your facility as well? Is there food
Oh,
provided?
yes.
Okay.
Sorry, I
So
keep talking over you. I'm sorry.
no, that's okay. That's all right. That's all right. I know it's passionate work to be working with people like this and helping them, because oftentimes caregivers are exhausted themselves. Oftentimes caregivers, get to a point where they really need the help and the relief, and they're surprised to know that close by there's a facility like yours, like Vitra Health, that will not only care for their loved one for a few hours so that they can care for themselves and for their loved one better, but also be able to have their loved one picked up and brought back, and then go to the doctor's appointment. So I think that's terrific. You're on the west side of Brockton, so would you pick up clients in Easton and along the border there?
So right now, anything is possible. We are, just because of the pandemic, we have to have certain regulations in place as far as in the van.
Okay.
Those routes have not been established yet. So right now, everything is on a case-by-case basis. I'm sorry to say I can't tell you
Yeah.
exactly, but given the fact that instead of having a van that maybe can hold 10, we maybe now can only hold 5.
Okay.
So
But it's
that
on an
definitely.
individual care basis.
Correct. Correct. Every aspect of Vitra Health is really individualized. We, from our AFC program to our VNA to our ADH program, we really look at each client or patient for themselves. We offer, nursing support, case manager support. We have social work on board with us, and we provide family assistance any which way we can. One other thing that I feel like really separates us from the rest is Vitra Health will assist and continue to help you in maintaining your health insurance. For many people, Mass Health is very confusing. It's very tedious. You miss a letter, maybe it doesn't get delivered. You forget it, you lose it. We'll work with you to continue your health insurance so there's no lapse in coverage. We work with Mass Health. We work with a lot of the other senior care option agencies in our area as well.
Okay. You talked about the facility having like recreational areas and even sound like gym equipment or rehab equipment. So how does a client use that facility? Is somebody there to help guide them through the use of after stroke or something, redeveloping their ability to use their arms or leg or that type of thing?
So all activities have to be signed off by either a physical therapist or an occupational therapist.
Okay.
That is actually non-negotiable. It's a requirement of all adult day health centers.
Okay.
So all of our activities are looked at and made sure that it is safe for everybody involved.
Okay. So we just talked about really a service that's provided by Vitra that brings people who are living at home and want to get out for the day. It sounds like you also will go to the home and care for someone or help care for someone in the house, even if there's a family member who's there. Can you tell us a little bit about that part of the business?
Sure. We have 2 different programs. Well, we have several different programs. Our most popular is our adult family care program, and that's in which a loved one lives with somebody who needs help. It could be their mother, their sibling, their cousin, a friend, their child. After a certain age, they have to be 16 or older in order for the parent to be able to get paid for that. And that's what we do, is not only do we provide medical oversight in case management and nursing, but we also pay them bi-monthly on a debit card. So very similar to direct deposit. They don't have to look at the mail every day waiting for a check. It goes right on twice a month. It's automatically loaded onto their card. And that is actually a tax-free stipend. So we find that a lot of people in these scenarios where there's multiple generations living in the same home, sometimes there are other financial issues. Sometimes there are, care providers aren't able to work outside of the home because their loved one needs so much care. So them caring for their loved one will not impact them getting any other services. This will not show up as income. It won't put them over the guidelines for food stamps or fuel assistance or housing or whatever other services they may be trying to get or already have.
Mm-hmm. So this is surprising to many people in Massachusetts that a loved one can get paid to take care of their mom, their dad, their cousin, their brother, the sister, someone that needs care. And so tell us again how that works. You said, how do you qualify for that, and how is it determined? How much?
So we are heavily Mass Health funded. We're a Mass Health Strong program, and how you find out if you're eligible or not is you just give me a call, and I'll give my phone number, my information at the end. We take a look at your insurance and make sure it's a qualifying insurance. Mass Health Standard is United Healthcare, Tufts, Community, Commonwealth Care Alliance, Boston Medical Center, for a few. There's more, but I'm not going to list them all. But all they have to do is reach out, we'll run the insurance, and we'll get everything started. We also have other programs. It's called Group Adult Family Care, which is if you don't have a caregiver, you maybe don't have somebody to take care of you, and which will supply the caregiver. There are Vitra Health employees. We will supply the caregiver to come to your home and take care of you.
Wow, that's nice that all they have to do really is to call you, Kathryne, yes, and you'll help guide them through that process, answer some questions about their loved one and the level of care, and then find out what they might qualify for through their own insurance that's already in existence.
Absolutely. And it's their benefit. So they're not, it's kind of a use it or lose it type of, scenario. I know there are some people that feel poorly about having their child be paid to care for them, but it is a benefit to them through their insurance, and they shouldn't be. Mm-hmm. That's what it's there to help that family.
Mm-hmm. Does the loved one, do they have to live together, or can they live apart and still qualify?
So there's two separate programs. So if they live together, it's the Adult Family Care Program. You have to provide at least 21 hours support a day. So that includes during sleeping time, et cetera. And obviously you need to live in. And we also have, we talked about real briefly, the group adult foster care. We also have the family group adult foster care, which is when the family member doesn't live with them, but provides care at least daily. That program is taxed.
Okay.
So that is something you will receive a 1099 for at the end of the year.
Okay. And is it the same type of parameters in terms of hours and the same type of reimbursement?
Nope, it's different reimbursement. There's different levels. So that would be something that would be dictated by our intake team.
Okay.
Once you get to that level. So for the family GAF program, in which your family member lives nearby and they're going to stop by and care for you, it has to be at least 1 hour a day, 7 days a week.
Okay.
And all of our programs come with nursing oversight, case management, social work.
So you're not just caring for your loved one on your own. You have those support services. And again, that's why people should really step out if they have a need. Don't suffer alone and don't get exhausted and wear your own health down without seeking help from Vitra Health and Kathryne. That's why they're here. And that's why they've moved to the city. You're not just here, from what I understand. You're in Braintree, Fall River, Lawrence, and you're saying you went from about 40 employees to 160, and I see you're advertising for many more in the Brockton area.
We are growing like a weed. We are excited to welcome new Vitra Health employees. We really, our priority is really taking care of our loved ones and our community members.
Mhm.
And that's everybody. You know, we really focus on our community that, you know, is a mass health population, which is a lot of time ignored by a lot of people. They think, oh, mass health, I don't want to take that. I don't want to be involved in that. It's a lot of red tape, but that's what we specialize in. That's really the community that we want to reach out to. They already are struggling enough, financially, emotionally, physically, mentally. We want to be there to help them and support them in their own home to make sure that they can age in place, that they don't have to go to a skilled nursing facility or assisted living, because the insurance usually doesn't cover those programs.
Sure, and we also know that most people want to stay in their homes when asked. They don't really want to go to an outplacement facility if they can stay at home. And I think the insurance companies acknowledge it's probably healthier and more cost effective for them to have peace of mind and stay in their homes, which I think is the genesis of a lot of the models that you're talking about here, where you pay a loved one either through a stipend or through a pay to take care of them at home with the support services of Vitra Health and your nurses.
Absolutely. We're really excited too, because our VNA, our visiting nurses program, is really kicking off, and we offer something that I feel, coming from a world of knowing about different VNAs and such, we offer one thing that I believe is overlooked a lot. We offer medication management, and we also offer that for psychiatric patients, which is not that common. It's extremely hard to find somebody willing to take on a mass health patient who has a mental illness, which is right now a lot of people are struggling with post COVID.
Sure.
You know, the depression rates are up, the anxiety rates are, all of them are escalated after this last year, and we will actually help them help them maintain staying on their medication through our visiting nurse program.
So many people think of home health and adult daycare as senior citizens, but it's not always, right?
It's not. It can actually be for our adult day health program, it's 18 and older, but for our adult family care program, it can be 16 years and older. Generally, those 16 or older are disabled, and we do help their parents by paying them to care for them, so they can stay at home with their child.
Okay, that's terrific, and that's really shining a light on an area that most people, again, don't understand about home health and adult daycare. That it can be children, you're saying, from 16 up, given the particular circumstances. So, typically in a day, what do your staff do and provide in terms of services, especially, well, at the adult daycare care center?
Well, they provide medication, they provide, you know, medication oversight, they provide a safe place. Number one, that should be first. We provide a safe place for our clients to come to, that their loved ones don't even have to worry about, you know, is my loved one going to be safe? Are they going to get their medication? Will they eat? They also don't want to just put them in front of a TV. You know, we want to see those who come here to be active, you know, at their level that they're able to be.
Sure.
You know, we have chess, we have pool, we have foosball, we have cards, we have gardening, we have exercise classes, we have quiet space. So if you just want to be by yourself and maybe read a book, that's okay too. We have lots of space. It's a 10,000 square foot facility. It's amazing.
And recently opened, right? You haven't even done your ribbon cutting yet.
We haven't. We're about to open hopefully soon, as you know, as the numbers continue to go down and we're able to get people in safely, we will open. We were supposed to open before COVID, and
okay,
unfortunately
so there's been a pause, but now it's ramping back up with the governor and the CDC allowing reopening starting June 1st. Then I would think your facility is going to see a lot more interest as we come out of COVID and into a new normal.
The new normal.
Yeah.
I think the great part too is we've done a lot of research in the Brockton area with local primary care physicians and reaching out to them and asking them, Are you comfortable in sending your patients? Would you be willing to sign off on this? Not just their patients, like a specific patient, but their patients in general. Are they ready for that? How do they feel? And the response has been great. People are ready to start coming back. They're ready to get back out into the world.
Yeah, that is terrific. And can you tell us a little bit about the interior of the space? That was a renovated building. It sounds like Vitra Health renovated it, and
We
and
did.
it must be, everything must be new.
It's brand new. We have multiple handicap bathrooms, including a handicapped shower, which is very rare. We have 2 nursing stations, 2 activity rooms, large, very large activity rooms, 2 separate dining areas. We have a restaurant style kitchen, which we will follow any diet that the client needs. We will have people on different diets, heart healthy, low carb, diabetic, etc. So, sorry. So we have the nursing station, we have the exam room, we have conference rooms. So if families want to come in and they have concerns, they can sit down with the program director and the nurse. You know, concerns like, oh, I think my loved one is needs a medication adjustment. They need more activity. They need less activity. You know, anything. There's private areas to talk. So there is some, you know, there it's very HIPAA compliant as well.
Okay. And I understand that you have staff that speak different languages.
That is one amazing thing I can say about Vitra Health is we are a company that is a gigantic melting pot. We have employees that speak Cape Verdean, Spanish, Russian, Haitian, English, and I'm sure there is more. I'm sure there's more there. As I said, we're growing like a weed, and every day I see somebody's name pop up and I'm like, who's that? Where do they come from? Unfortunately, I don't speak a second language, but I'm looking into learning. I would like to learn Spanish.
Great, terrific. So it's nice that you're in Brockton and you have a diverse workforce. We have obviously a diverse population, and we're centrally located to a lot of communities that we define as Metro South. Your facility is over there on North Pearl, so it's near Easton and Stoughton, and in that area, less than a couple miles. So I imagine you'll attract folks from those facilities, and your nurses and caregivers will probably end up in homes helping people in those neighborhoods, not just in Brockton, but in Easton and Stoughton as well. So what is the application process for someone if they're listening to this video and they're interested in learning more or seeing if they qualify? What's that process like?
It's really quite easy. All they need to do is give me a call. Should I give my phone number?
Yeah, go ahead, and we'll post it down below.
Okay, it's 508-243-3836. They can call me or they can text me. They just let me know that they saw this interview. We'll take a short referral. It's just pretty much basic information, name, phone number, date of birth, what is your primary language, who's your primary care physician, who's your emergency contact, do you have a caregiver? If you do have a caregiver, who is that? So, and then we verify their insurance and it goes off to the intake team. The referral process, my end of the referral process takes about 10 minutes total. It's extremely quick.
Very efficient. Wow. And then typically in your experience, I mean, what would be the quickest you'd see someone for services?
Well, you know what, it's been a little bit tricky to answer that, to be honest
Because
with
of
you,
COVID,
because of COVID, and people are still working remote as I am, and I know you are. A lot of things we do still need to get signed off by their physicians. Some of their staffs are still working remotely. So that's been a little bit of challenge, but I can't say exactly how long it will take because every case is different. But we hope to see people onboarded between 2 and 4 weeks.
So it really is customized care, and you do an individual care plan, it sounds like, and really fit the services to the need of the client. And it sounds like you're in a position where you can actually expand those services if need be, or transition them either back to home or from home to the daycare, adult daycare. And you've got transportation as well.
Yes, that is a huge thing. I know In the Brockton area, there is buses everywhere, but nobody wants to put their loved one on a bus. Not knowing where they're going, they may have memory issues, they may get lost, they may wander. So we will come pick up the clients at their house. We're able to take them to and from local medical appointments if needed, and drive them home.
That's really terrific. It's great. What a great service. And we're so delighted that Vitra Health has come to Brockton and provided the services in particular. We're also delighted about the jobs. And I know, again, I was on the site and I saw how many jobs openings are still available. Can you talk a little bit about that, or how people would learn more about the jobs that are available?
Absolutely. All they need to do is go to our website, which is www.vitrahealth.com, and go under careers. It is a great company. We have a great work-life balance. We are all here because we want to care for our community residents. That's the end all be all. We're all here because we have giant hearts and we really want to see them succeed and stay in their homes.
Well, that's fantastic, Kathryne, and I'm delighted to have you with us. And obviously, Vitra's delighted to have you and lucky to have you as a spokesperson for the organization, and also caring for the residents of Brockton and the surrounding area. So, as a nurse, it's important that we have folks like that.
I'm not a nurse. I don't want you to. No, it's okay.
Okay.
Maybe I should tell you about my title.
Yes, please.
Okay. So I am the community development manager for the South team, which covers from Quincy down to Fall River, New Bedford, Wareham, Plymouth, and back up 3A. So pretty much anything south of Boston is my territory.
That's terrific. That's terrific. Yeah. And the title, so we'll add it into the video as well.
Okay. I am the community development manager for the South team.
For the South team. Okay. All right. Terrific. Terrific. So thank you very much. Is there anything else you think we should add or include?
I think you covered everything.
Okay. Great. Terrific. Well, it's so nice to see you again, and we look forward to your ribbon cutting and participating in that. And let us know. We'll invite folks.
Oh, absolutely.